I'm going to go over some exercises stretching for tension headaches. All right, so the first one, what I want you to do, I've explained a little bit of these before. I'm going to be stretching the right side of my body. So what I'm going to do is I'm going to drop my shoulder down. With my chin, I'm going to look up into the corner. So like that. This will stretch right under your clavicle into your shoulder joint. So really that area, if you're really tight, you'll get the whole line. Okay, and then bring your head back and your shoulder up. Now to stretch the opposite area of that muscle line, drop your shoulder down, put your chin down, and move over. So that stretches the back. That stretches the back side. And then move your head up and your shoulder up. Okay, so now I want to do stretching right here, this muscle. Okay, so this muscle gets short when we're doing a lot of typing, engineers or electricians, when we're using a lot of tools, constantly using this motion, because your neck kind of goes down so you can see what you're doing. So we want to lengthen and stretch that back out. So the first one to do is I'm going to push right under my clavicle and hold that. Okay, as I do the motion, it's going to pull the fascia and the muscle to stretch it. It might feel a little rippy or a little burny, and what that is just you're stretching out that fascia. So it's the adhesions that kind of stick together and they don't move as they should. So we'll hold down that right under the clavicle, and I'm going to look up and look up. And this isn't, when we're talking about ripping adhesions, it's fast movements, quicker to rip them, right? So they're not long stretches. So I'm gonna hold this down again, and you can probably see this muscle flaring up. So that just helps kind of create more movement in the whole joint itself. All right, so now I want to move into your jaw. So I have two exercises or stretches for them. What I want you to do is right along your zygomatic arch, and go right under. It's also your cheekbone. You're going to push up, right? There's a ridge right under here that you can push in. And you can do it all the way back. When you get back here to your jaw, it's thicker and it's harder. And so it'll be more difficult to get into there. So I want you to start up front. Push up. Okay, now I'm just holding it. So I'm going in and up a little bit. So in and up. Now just hold that to kind of get the ligaments relaxed. Breathe, try and let go of the jaw. Then I'll move it out and just hold that to kind of wake up, do some neurofeedback, get all the little proprioceptors moving again. Okay, now that I have the attention there for my body, I'm gonna put my fingers back in the middle of the front and back, right here, and then open my jaw. So you can do both sides at once. Now this is painful. My jaw, I bite my jaw a lot. And if you're curious if you're clenching your jaw at night, you can open up your mouth and look at your tongue right here. So there's some ripples in my tongue because when you're biting your jaw, your tongue slides forward into the bottom of your teeth and it makes little ridges along your tongue because of the pressure. So right there. It's hard to see on camera, but that's kind of a quick little test I do when I'm curious how much my client is grinding. So anyways, go in here and open, and then open and go to the side with your jaw. So those are pretty sensitive, but as you continue to do these, it'll loosen things up. It'll prevent tension headaches, migraines, and TMJ, jaw symptoms. So I hope that helped you guys.